interesting topic to discuss. It's all about depression. We have people asking us, what at all is depression? Am I experiencing depression? What do I do if I have depression? This is the conversation that we are going to have today. We are going to answer these questions. Before we go on, as usual, let me indicate the housing rules that we've worked with over this period that we've been having these seminars. Foremost, I entreat all of you to keep your microphones on the mute. Our facilitators would unmute themselves when it's necessary and have their go. Again, when we get to the question time, as usual, you would have to raise your hand. I would identify you and allow you to share your comments, suggestions, or a question if you do have one. We are discussing a mental health issue, and I plead with all of us to be sensitive in our comments, suggestions, if you are given the opportunity to share your perspective. So we are good to go. Our Chief Executive, as usual, is with us, and he would have a few words for us before we go into the action. The sweetness of the pudding is in the eating, so today we'll not waste much time. What we have would be interesting. Prof, are you there, please?
Okay,
hello, Prof.
Yes, I'm now unmuted. Yes, very good afternoon to you all. And as our moderator said, this is the last of our series of Zoom meetings, webinars for this year. And it's a good number to start with. You are welcome. Merry Christmas and a Happy New Year in advance.
Thank you.
I think it's important that we are discussing this topic as we are getting towards the Christmas festivities. Depression, as our moderator rightly said, and I must say that it's quite an enigmatic illness, generally. It's like malaria can present itself in various ways. Sometimes you have headache, other times no headache and joint pains, other times slight vomiting here and there. Depression can similarly present in various ways, and then you can get confused as to what is happening to me. You feel sad, you feel moody, and that's not always present that way. Sometimes the opposite is what happens. You might be a little, maybe happy, and yet the real depression is masked. You may not be able to eat, or you may eat more. You are not able to sleep, or you may sleep more. It could be quite enigmatic. And then you can go doctor shopping. These are issues that we want to discuss now, so people will get a good understanding. And again, as I related it to the festivities, during the festivities, then people begin to think of what they could have been doing, which they are not able to do. Emotions will come in. I've lost a dear one who would have been with me, but it's not here. All this will impact on us. So we have the opportunity to discuss these issues so we can fully, at least more fully understand the issues of depression. I'm making these comments because I may not be able to sit in throughout, but at least these initial comments are important. We have a crack team of presenters, and they will surely delve into this. So I wouldn't take the wind out of their sail, and they will take us through the epidemiology, how common, how widespread, and the various ways of depression manifesting. On that note, I want to say thank you very much for your joining, and I trust that you'll go home with more understanding of what depression is in our daily lives. Thank you.
Thank you very much, Chief. That's our hardworking Chief, traveling on the go and still being with us. Thank you for being with us.
Sure.
Thank you for being with us.
Welcome.
So the sweetness of the pudding is in the eating. And we have experts in academia and in practice who are very familiar with the topic under discussion today. Foremost, we have Dr. Jonathan Odame. He is a clinical psychologist as well as a lecturer at the University of Ghana, Legon. We have Miss Gifty Adjoa-Mensah. She is also a counseling psychologist and head teacher and an educationist. In addition to them, we have Dr. Peggy Asiedu-Ekrement. She's a specialist psychiatrist at the Accra Psychiatric Hospital. So you see that we have all the angles of expertise covered. So they are going to bring us to the basics of what depression is, how when they meet people, how they say it. And so we are good to go. We are good to go. We are good to go. So let me start with you. Dr. Damin, are you there? Okay, he might have dropped off this network. All right, Madam Gifty, what are the common risk factors that are associated with depression, particularly with those that you have engaged with? What are the common risk factors that you notice among them? In fact, all of you facilitators will take a go at the same question so that we'll have different perspectives from the clinical psychologist, the counseling psychologist, and the psychiatrist. So Gifty, have a go at it. When you are done, Dr. Peggy will also have a go at it. All right then. Thank you very much. Yeah, I believe some of the risk factors of depression will be one, death or loss of our loved ones. There is something that worries us a lot, and it's very difficult for people to go through. So that sadness and grief are normal reaction. Those such big stresses can bring serious symptoms of depression, like thoughts of suicide or feeling of worthlessness. Yeah. And then another point that I can make is about conflict. That dispute with family or friends may also lead to depression. Then when it comes to abuse, there's past physical or sexual, and the emotional abuse can bring it on as well. And then some of our life events, even good things like moving, graduating, could also make you depressed. Then other changes can also do that. That includes getting a new job or loss of employment or income. Then also marriage, when you're about to get married, you see the tension that comes on us. How are we going to face the crowd? What are we going to do? All that we need to put together becomes a problem for us. Then another point is divorce. When we go through divorce, a lot of them, we have them in the system. You see how depressed they become. Then when it also comes to retirement, people think, the little that I'm getting from my salary, I'm not going on retirement. What am I going to do? I'm not even putting up a house, where to put my head and all that. Then you become depressed of these things. Then sometimes also having a baby. Then another point that I can also add is medication. Well, sometimes some of these medications, the side effect of it ends us in being depressed. So there's a few that I can also add up to. Yeah. Okay. All right. Thank you very much. Hold your gun. We have other experts. Let's hear from their perspective. Dr. Peggy, as a psychiatrist, with those that you have engaged with, do you find any risk factors that is quite different from what Gifty has said? Interestingly, there are good things of life that gets us to feel depressed. From your perspective or from your practice, anything different, Dr. Peggy?
Okay, thank you very much. So some of the risk factors are similar to what Auntie Gifty said, but one important one is a family history of depression. So genetics, your genetics can actually predispose you to have depression. It's similar to maybe somebody who has hypertension, or your father and your mother they both have hypertension. Then later due to a gene and environment interaction, you may also develop that. That's also seen in depression. So if there's an interaction with some of the life events and you're already predisposed, you can have that. Then another risk factor is also your gender. So it's been seen that depression is commoner in females. It's said that females are twice as likely to have depression as compared to their male counterparts. Other things such as certain substances that we take. She talked about medication, but there are also other substances, especially alcohol. Sometimes people don't realize that in the long term, alcohol is actually a depressant. We call it a depressant. So alcohol can actually also get you depressed. She talked about childbirth as well. Even sometimes the stress of pregnancy itself can also predispose people to being depressed. These are the few ones that I would like to add. Thank you.
Thank you very much, Dr. Peggy. That is straight to the point. Now, it looks like we know all the risk factors that could get us on the path to depression. There are good things and there are bad things. But from all that we've mentioned, for me, then it means that we need to be careful of our life, because every little thing that happens with us puts us on a path. Because if I have a new house and I want to move in, organizing myself to move in, if I don't organize myself when I don't get my mind straight, I could be on that path. That's quite interesting. Dr. Adame, are you in? I don't see him on it. Internet. Well, ladies and gentlemen, whilst we are on it, I would encourage you to send in your comments or your questions beforehand. I'll read them whilst the program is going on. Okay, Dr. Peggy and Dr. Gifty, let's move on. Now, I want us to look at how, basically, we know what the definition of depression is: unusual sadness, loss of interest in life, and all that. But when we come to the ground, oh, Dr. Adame is back on.
Yeah, thank you very much. I had internet connectivity issues.
I suspected so. So.
Thank you very much.
But were you able to hear Gifty and Peggy?
Yeah, when I joined, Dr. Peggy was speaking, and I realized she was talking on the risk factors of depression. Yeah, that's when I joined.
Okay, that's right. So if you have anything new to add, you can do that. Other than that, I think that they've exhausted with a lot of risk factors on that.
Yeah, I agree with what Dr. Peggy said. On the family history, sometimes it could be linked to genetics. So there's a likelihood that if a family member once had depression, or there's a history of depression in the family, people in the family could also be predisposed to depression. I had a case of a mother who was once depressed, and she had a 13-year-old daughter who was also depressed. From the assessment, I realized that because the mother was depressed, there was a likelihood that the child might have also had those symptoms of the depression. And another thing that maybe I could add is also perceived economic problems. You know, now, because of financial issues, people may not be able to meet their needs. Their economic challenges are always battling with them and the rest. So it also can predispose people to depression, and also unemployment issues. A lot of people finish school, whether vocational or technical, and they send their CVs around, they want work and they are not getting employed, and all these things could predispose people to depression. So we don't have a single cause of depression, and we have several causes of factors that can predispose people to depression.
Okay. Thank you very much, Dr. Adame. But when Chief was having his go, he made a few points on what depression is and why we need to talk about it. Now, we've mentioned the risk factors that can get somebody prone to. There are the good things, there are the bad things, good things in life, that is what I mean. Now, Dr. Adame, you alone, please do that for me. Give us a clearer description of what depression is. When we say depression, so that we'll pick from, even though Chief has done that, give us a clear, when we talk about depression, what do we mean?
Okay, thank you very much, Dr. Arthur. To a lay person, for us to understand depression this afternoon, I would say depression is a state of prolonged sadness. Yeah, it's a state of prolonged sadness, and it's a state where the person is sad for almost about 2 weeks. And within that 2 weeks, the person is not able to enjoy his or herself. The person can't eat. The person can't sleep. The person has lost weight. The person, in fact, he has lost pleasure in a lot of activities. So depression is a whole body illness that affects the way you think, the way you do things, and the way you interact with your surroundings. So basically, it's a mental illness. It affects the mind, and it's a state of prolonged sadness. And oftentimes, it lasts for like 2 weeks or even more. But within the 2 weeks, you should have about at least 5 symptoms of depression for us to say that you are really depressed. So I would say that to a lay person, for us to understand depression is a state of prolonged sadness. Nevertheless, somebody can also be depressed, but he may not be sad. The person, I have a patient like that, she was so depressed, but she was gaining weight. Whereas people who are depressed always lose weight. So in a nutshell, when we say depression, it's a state of prolonged sadness, which lasts for like 2 weeks, and it calls for attention. Thank you.
Thank you very much, Dr. Damin. That was clear and concise. Prolonged sadness for a period not less than 2 weeks. Good. Now that we have this, now let's get to when you have clients who come to you. How do they present their signs to you? What do they tell you? Do they tell you like the normal signs that you are describing to us, you are listing for us, or they tell you in different ways, and you as a specialist, you are able to deduce that this is what we are looking at here? Let me start with you, Dr. Peggy.
Okay, thank you very much, Dr. Arthur. So as has already been said, people who have depression present in various ways. The typical one, they would come with what we call core symptoms. I think Dr. Adame has talked about it, prolonged sadness and all. Some people who also had interest in certain things, you realize that they've lost interest in those things that they used to enjoy. Then sometimes you realize that the person feels that their energy has gone down, or maybe relatives will even describe it as, she's become lazy, or he's become lazy. He wakes up, he doesn't want to do anything, etc. So those are some of the core symptoms. But in addition, as he said, some people are not able to sleep well, or they wake up very early. Some people lose weight. Some people actually will gain more weight. Some people can even become a bit agitated, because we typically will say that maybe somebody who is depressed will be slow and all, but some actually can be agitated, or they may even respond to certain, so when the person is at work, for example, the person is happy, but when they go back home, it's a different story. They're not able to concentrate. Some people, it gets to a point where the person feels that I'm not worth anything, or there's no hope for me. So then they start entertaining thoughts of death or dying, to a point where they can actually have thoughts of wanting to harm themselves or kill themselves. And if that goes through, then that usually ends in suicide. So these are the typical ones that we see. Saying that, I must say that this is for like maybe the adults and adolescents, but in children, it can be a bit different. A child who is depressed will not come and say, I'm sad, or I don't enjoy these things, but you realize that maybe the child has now become a bit irritable, or somebody who was doing well in school has stopped doing well in school. The child has started urinating on bed again, or they're just giving so much behavioral problems. These are it differs a bit in the adult one. Yes, thank you.
Thank you, Dr. Peggy. So, Dr. Damin, with what Dr. Peggy just said, now she listed all the signs and symptoms. Would somebody experiencing all this thing tell you straight away as they are telling you, or they will tell it in different ways, and you as a specialist would have to pull it out and know that this is what the person is experiencing? So I have to ask specific questions to lead me to that, depression. Okay, how does it go?
Yes, Dr. Atta. You know, as human beings, we are all different. As human beings, there are some times in our lives that we may feel sad. There are some times in our lives that we may feel happy. So before I will diagnose someone of depression, I have to at least give the person an assessment too, for me to even know the level of depression. Because some people's depression can be more normal, can be low, can be severe, and can be moderate. So oftentimes, before I go ahead to diagnose a person of depression, I do an assessment of the person. Not long ago, I had a case of a woman who was depressed. She came to the hospital. She was telling me that she is the wife of Jesus. She sees Nebuchadnezzar. She hears voices. She sees Mary Magdalene and the rest. But after the assessment, I realized that she was going through some levels of depression. And for you to diagnose somebody as depressed, you don't just diagnose the person as depressed, because if you are depressed, then it calls for treatment and management and even psychotherapy. So most of the time, the person presents certain symptoms to you, and you go back and ask the person that, of course, maybe within the last 24 hours, how do you interact with your environment? Are you able to concentrate? Are you able to remember things? Some people may come to the clinic, they are not moody. They will appear normal, but from the assessment, realize that the person may be going through some form of marital problems or marital issues. So based on what is causing the person stress, that is the stressor, then you can now relate it to what might be causing the depression. So before I would say that somebody is depressed, I'll do an assessment on the person. So based on your score on the assessment tool, then I will know the level of depression, if it is normal, it is moderate, or it is severe. Some people may come to the hospital with an issue. Maybe the person has been told he has cancer. And from that time, the person has stopped eating. The person is losing weight. The person has stopped going to work. The person will tell you that, oh, for some time now, I can't sleep. So when you do the assessment, you trace back and know that maybe 2 weeks ago, he was told that he had cancer, and that is what has brought about those depression or those depressive symptoms. So before I diagnose somebody of depression, I take the person through a process for me to even know the level of depression a person is experiencing at that point in time.
Okay, all right, thank you very much for that response. Now, sometimes we go through some sort of sadness and we characterize it as depression. Sometimes there's also that clinical depression. There is that difference. Dr. Peggy, what is the difference between normal depression that shows sadness or that clinical depression? What is the difference?
Okay, thank you very much. So as you rightly said, it's okay to be sad from time to time. Something may happen in your life, you may feel sad or you may feel down. But for us to categorically say that this is a disorder, it has to be something that is different from your usual. So the sadness, the low mood, or the low energy and things, they have to be present at almost every time, almost every day, as we say, present throughout the day, or most times of the day, almost every day for at least 2 weeks, like Dr. Odame said. And it has to impair, for us to say that this is different from the normal sadness, it should be of a level that is actually impairing your function. Because if somebody steals your money or you lose some money, you lose some money, you get sad, but you get over it. But this one, it's there constantly. It's impairing your function. You're not able to concentrate. You are always crying. You're not able to work. Those are some of the things that help us differentiate normal sadness from a disorder which we'll call depression.
Thank you very much. So we are clear on that. When you're experiencing that depression, that impacts on your functionality for quite some time, minimum period of 2 weeks, most of the day, most of the time, then it means that you have a problem at hand that you need to attend to. Thank you very much, Dr. Peggy. Gifty is back on. Okay, Gifty. Hello, Gifty, can you hear me? Hello, Gifty.
Yeah, I can hear you.
Good, good. Can you please, so what is the outlook of individuals experiencing depression in terms of their behavior, their feelings and thoughts? What is their outlook after they present, when they present themselves, what do you see? What is their outlook?
With the outlook, I know it is mild. Sometimes it's mild, and sometimes too it's severe. And then sometimes too it comes shortly, and other times too it is very long. It takes a long time for them to go through. So that's the outlook of it. And then when this is not dealt with very early, that's when you see them trying to hurt themselves or kill themselves.
So in effect, there's the severity, severity of the condition. It could be mild, it could be moderate, or it could be severe. Okay, exactly. And so that with somebody experiencing mild depression, how does that person, how do you see that person in terms of how the behavior that person expresses his or her thoughts? How different it is from somebody who is not experiencing depression? How different is it?
With the mild one, sometimes, yeah, you see the person mingling with others, all right, not showing a lot of symptoms of the depression. But with a severe one, you see the person coiling out, not trying to mingle with others, always seeing the person alone. That's how you see it. Okay.
Dr. Adame, do you have a different perspective to that? What is your experience?
Okay, thank you very much, Dr. Atta. And adding on to what Madam Gifty just said, you see, when it comes to depression, depression is the umbrella term. But people, there are about 7 types of depression that people normally go through. So as a psychologist in my practice, some people may come to the hospital, they may be having what we call situational depression. And this is the type of depression that is triggered by something that has happened, such as the death of a loved one or a breakup or a relationship. There was a patient like that who wanted to commit suicide because the roommate had taken the girlfriend and he was dating the girlfriend. She realized that the depression that he was going through at that point in time was based on a situation that had happened. Then we also have other types like persistent depressive disorder, where some people may be having depression for more than 2 years. Because even depression, we have what we call even the bipolar, where the person at one point in time will be happy, and at another point in time, the person will be extremely sad. And we also have what we call the postpartum depression. And most of the time, this is where some women after delivery, they become so sad, even to the extent that some even would like to kill their babies. There was a woman that I was attending to. She gave birth, and after delivery, she was not happy about herself to the extent that she even wanted to put the child in an oven. So depression itself is the umbrella, but we have several types of the depression. People may have depression and they may be having psychotic symptoms. There are people, when they are depressed, they hear voices, they can naked themselves, they can do things to themselves. So in terms of the question you asked previously about the sadness and the depression, you realize that we are all human beings and we sometimes feel sad. Because sometimes, because of life expectations, there are some things that you want in life that you may not get. Maybe you're going to write an exams and you don't pass the exams. As a human being, you'll be sad. But if the sadness takes a very, very long time, then it turns into depression. So sadness lasts for a very short time, but depression lasts for a very long time. Somebody might have lost their mother about 2 years ago, but every day he or she is reliving the experience as if the mother died just this morning. And the person is not happy about it. He's always crying, he's always shouting. And I also want to talk about what Dr. Peggy said on the gender. Research has shown that women are more prone to depression than men. And of course, in my statistics at the hospital, I see more women being depressed than more men being depressed. Why is this so? Because of our culture background. Men don't come up. Most of the time, you see them are issue. So a wife will be beating the husband, but who will you even go and report to? When you go to DOPSU, for all you know, you go and meet a woman there. Can you tell a woman that your wife is always beating you at home and you are crying? There's that stigma. So when it comes to depression, people may have different types of symptoms that they exhibit. Sometimes even, I would call even a seasonal affective depression. Some people become depressed when there's change of weather. Now that we are in the Christmas season, there's winter, there's Hamatan, it may even cause depression on some people because of change in the season or in the weather at the moment. And even recently, there's a lot of traffic in Accra. You are going to work, you are going for interview, there's so much traffic, it can cause people to be depressed before they even come to the psychologist for treatment.
Right. Thank you very much for that explanation. So, Dr. Peggy, you are the Accra Psychiatric Hospital. Tell me, does depression lead to mental illness, or it's a mental illness in itself?
Okay, so thank you very much. So depression is a type of major mental illness, as we may say it. It will not lead to, it is a type of mental illness. As I said, for us to be able to quantify something to be a disorder, something that it's different from the usual, like I said, the severity of the symptoms counts, the durability, as in how long it has been, also counts. The impairment on one's function also counts. The fact that it is not due to other things, maybe such as medication or maybe a substance which is causing it or other medical condition, if it's not due to that, it qualifies to be a mental disorder. I want to add something small about the severity of depression, if I may. So I think Dr. Odame mentioned
Please go
that.
ahead.
Sure, thank you. So clinically, we are able to determine the level of severity of depression, so as mild, moderate, or severe. Mild for us, I talked about some 3 core symptoms. You must have 2 of those core symptoms plus at least 2 of the other symptoms, such as the sleep disturbance, the weight changes, appetite changes, hopelessness, etc. For the moderate one, you must have 2 of the core symptoms plus at least 3 of other symptoms. Then for severe, we would say that you must have all the 3 core symptoms, which are the low mood, the loss of pleasure in the previously pleasurable activities, and the decreased energy. You must have all 3 of that, plus other, plus 4 of the other symptoms. And for very severe depression, as Dr. Odame said, some people can have other symptoms, which we will term psychosis. So they may have or they may not have. And some of these psychotic symptoms of things that we say that are out of touch with reality include hearing voices which are unheard by others. So you're the only one hearing it. And some of these voices in depression may be condemning you or maybe even telling you to kill yourself, amongst others. Then others may also have very firm beliefs which you can't shake with evidence and which are not culturally or religiously appropriate. Some of them can include somebody actually saying that, oh, I'm very poor, even though the person has a lot of money. They strongly believe those things, or they may think that people are persecuting them, or they may even have inappropriate guilt. So some of them can even say that, oh, I'm responsible for the hardship in Ghana, please forgive me. They'll come back and keep begging and begging. Some of these are signs of psychosis, or they may have delusions of what we call worthlessness. They won't amount to anything, or hopelessness. So some of these are examples of the psychotic symptoms, which may occur in severe depression. And in severe depression as well, we may have people who may not talk at all. They may come as if they've gotten a stroke. So they are just there. They don't eat unless you feed them. They don't walk. Like, they become very slow. They won't talk, nothing. That's also another form of depression, so that we don't miss these ones. The ones we've been talking about are the typical ones, but depending on the categorization, you may have these. Then you can also determine the severity of depression objectively using instruments, as Dr. Odame mentioned. So when you come, they'll give you an instrument, you fill a questionnaire, then based on your score, we can know whether it's mild, moderate, or severe. Thank you very much.
Thank you very much for that elaboration. So now somebody has come to see you. You have the conversation and all that. Your suspicion and everything is confirmed that the person is experiencing depression, probably mild or moderate or severe. For all of you will respond briefly to that. What is the basic thing that you do after this realization? So, Dr. Dami, what is the basic thing that you do after this realization? What is the next thing that you do?
Okay, thank you very much, Dr. Arthur. I always tell my patients or people that your mind is your health. So the way you think about issues, the way you appraise issues can affect your mind and can affect your health. So oftentimes, after I've been able to diagnose the person as being depressed, and even know the type of depression the person is exhibiting in front of me in my office, then I start my psychotherapy. Yeah, I do more of cognitive behavioral therapy, where I use
Dr. Dami, I think we missed you, but Dr. Dami has gone off. Technology. Hello, Dr. Dami. I think it's dropped off. Gifty, would you like to take over?
All right then.
Please take over briefly. What is the next thing that what is the next basic thing that you do? Just briefly, because before we go into the sorry.
All right.
Want people to feel comfortable to come to you. That is why these questions are coming, so that they know that it's not rocket science when they need your help, when they need your support. So briefly, what's the next thing that you do?
Okay. Sometimes what I do is that I encourage them to see a health care provider, because they can give them an accurate diagnosis and then refer them to a specialist or suggest any treatment options. And then sometimes normally I use the CBT, that's the cognitive behavioral therapy, where they can change their mindset of thinking, from negative to positive thinking.
All right. Okay, thank you. Dr. Peggy, your perspective?
Okay, thank you very much. So at our end, we'll need to decide whether you can be treated on outpatient basis or inpatient, depending on your severity. And one important thing that we also do is we are assessed for the risk of suicide, because we know that depression is a very, depression contributes to 50% plus of suicide cases. So we need to assess suicide risk. Then we also, through our history, we were able to pick up certain factors that may be, certain risk factors that may be contributing to you developing this. For mild depressive episodes, we do not give medication. We refer you to a psychologist for psychotherapy. So you have intensive therapy to get better. But for moderate and severe cases, we do a combination of pharmacotherapy, that's medication, plus psychotherapy or what, and the commonest that is done is the cognitive behavioral therapy they've talked about, CBT, amongst others. It could include family therapy if maybe there's no support from the family. Depending on what we find per the individual, we manage appropriately.
Thank you very much. Now, our life is full of stress. We have family issues, work issues, social issues. All this has influence on us. We have individual influences that gets us, puts us on the path to depression. Per your experience, what are some of the things that people subject to themselves, that they allow themselves to experience, or the experience that puts them on that path? Can you list some of them, and how would you advise that they do not allow themselves to be impacted by this? So, Dr. Peggy, probably you could start then. Dr. Adame is not back yet.
Okay, thank you very much. I think Dr. Adame has mentioned some of the stresses which we quite commonly see. Unemployment. A lot of people are not getting jobs. With the onset of COVID, people even lost their jobs. Sometimes it's hard to, I mean, the person has lost their job to say, oh, get over it. You can't say that. Sometimes you actually need to let them have professional care. One other thing also is, you know, for women especially, getting married. Some people have been, or maybe family pressure. Oh, when are you getting married? When is a grandchild and things coming? We see that a lot. People are so much pressurized that they actually will become depressed. For that, a therapist can also help you, but for us all on this platform, I believe that everybody belongs to a family. Sometimes it's worth not being part of somebody's problem, because support is very important for getting well or staying mentally healthy. So for us, I would say that some of the ways we can help them deal is that do not contribute to family pressure. Hey, get married. Hey, you are growing old. Your time is ticking. No, I think we shouldn't do some of those things. Those are, and I think for men, it's also been said that culturally men don't are not supposed to express themselves. So sometimes you may be seeing somebody for an alcohol use disorder, but the root cause is depression, because they want to mask their sadness, their sorrow and everything. So then they would rather go and take alcohol to cover up their emotions. So I think those are the things that I would say. Thank you.
All right, thank you. I mean, so these are the things that we allow ourselves to be impacted, but we need to do not allow them to have an impact on us in order to prevent experiencing depression. Gifty, do you have anything to add?
Yeah, the only thing I can add is that sometimes poverty also creates this depression to us as individuals. And then homeless, where someone may travel to a place and is not getting a place to sleep. And then sometimes too, we have this unhappy family environment, and then violence. You have no peace at all. A lot of challenges. So there's almost pressure on you. So sometimes we say that don't take up everything by yourself. At least you can even assign people to do certain things for you if you think that the challenges are too much you can't carry, or the burdens are too much you can't carry. So these are some of the things that we do. And then when it comes to maybe looking for a job, you need to also liaise with people to help you out of that. So the few that I can add.
All right, thank you very much. Dr. Dami, are you there? Hello, Dr. Dami.
Hello, yeah. Yes, I'm around now. I was having problems with my connectivity.
Technology, yes. Technology. Now, my question is, people tend to hide what they are going through, particularly when it comes to depression. I would want you to advise people against that. You might add that support from their networks, the support system that they do have, is equally important. So foremost, advise people against hiding it, because hiding it doesn't end well. It has its detrimental consequences. So add that to social support, what social support can do for them. So Dr. Damin, if you can hear me.
Yeah, thank you very much, Dr. Atta. As I said earlier, your mind is your health. And what I'll tell people is that happenings are the same. Whatever you are going through, people may be going through the same experience. People may be going through the same problem or issue. So whatever that is happening to you, you don't need to sit at home, because even there's a statement that the devil gives work to the idle hands. The moment you want to hide whatever you're going through from others, then your mind may start suggesting things to you, because you are already going through some form of sadness, you're already depressed. So I advise that no matter what you are going through, try and seek for help, and also seek for good and quality help. Because in terms of health, there are so many help that you can get. You can even go on the internet for help. Whatever you are going through, you can go it on the internet and you get a response to it. So I would advise people to seek for professional help than to rely solely on friends who may not be so much experienced in what you are going through. For instance, just last week, a friend wrote to me that I should edit an article for him, and this friend is writing an article on marriage, and he himself is not married. So I told him that, see, after he's gotten married, then you retype the article and submit it to me, because experience is the best teacher. So what I'll tell all of us is that no matter what you are going through, there's always light at the end of the tunnel. All is not lost. There's a statement that we say, of course, if you're a Christian, Christ in you, the hope of glory. Tomorrow by this time, things might have changed. So don't sit in the house and think that nobody can solve the problem for you. For all you know, the psychologist himself may be going through the same problem and might have solved it and would help you to go to be able to cope with it. And in terms of social support, we all need each other. Sometimes it's not about seeing a psychologist, but there's a statement I always say that words can kill and words can heal. The words that we tell ourselves or we tell each other can kill us and they can give us hope. So we should help each other, because depression is not about one person's affair, it's about all of us, our affair. Because when we are depressed, it can affect a lot of things. Supposing a husband is depressed, and of course, most men who are depressed are not diverted attention. They can't even perform sexually. A lot of people may be going through psychological impotence because of depression. They have a lot of erectile dysfunctions. So if you are going through this kind of psychological headache or sex headaches, and you're a married man, and you don't open up to your wife or seek for professional help, it may even affect your marriage. So what I would tell all of us is that no matter what we are going through, we should seek for professional help than to hide our feelings, which may bottle up in us. Those who commit suicide, most of the time, they don't tell people what they are going through. They think there's no light at the end of the tunnel. They think that life is not worth living. They feel hopeless and they feel helpless, and that may cause them to commit the suicide. So no matter what you are going through, please seek for professional help and advice. Thank you very much.
Thank you very much, Dr. Dame. Just by way of little correction, we mental health advocates, we try to avoid the use of the word commit suicide. We say the person died by suicide. Somebody has suicidal intentions. This is an effort to decriminalize the suicide law that we have in this country. Gifty, you are the educationist. Let me ask you this. Do children experience depression? Hello, Gifty. Hello, Gifty, can you hear me? Before Gifty comes on, as I've seen a quick question, somebody's asking if there's going to be a question session. Yes, there is going to be a question session. Again, at the end of the session, there will be a recording of this program. The source in which you got the flyer, most likely, if you trace from that same source, you will get it. At the end of the day, it will be shared on our website too as well, and on our Facebook page. After a few questions that I do have, I would open so that participants would share their questions and perspectives on what we've been discussing so far. So yes, Gifty, can you hear me?
Yes, please. Yeah.
Yes, good. So I was asking, do children
okay.
experience depression?
Sure.
Is it different from adult depression?
Oh, not really. Because with depression, it doesn't have any age limit.
Okay.
It occurs, yeah. So some of these children, you see them, especially those who have torn dresses coming to school, you see them very depressed and other because they are not happy seeing their friends well dressed and then looking at themselves wearing untied dresses and uniforms to school.
So that the appearance of children itself sometimes can push them to depression. Is that it?
Sure.
What other things could also get them into feeling depressed?
Well, sometimes they are not fed when they come to school. They ask them to go just like that. So sometimes you see them depending on teachers and other friends for food. Even their learning materials too is a problem. And even the love that they need from their parents, they don't get it. So it's also a factor of them getting depression.
All right. Thank you very much.
Yeah.
Ajua Mensima say.
Dr. Arthur.
Yes.
Sorry, may I be permitted to add a bit about depression in children?
Very good. Please go ahead.
I mentioned a bit. So yes, children do get depressed, and I initially hinted that sometimes for those who are maybe close to adolescents, it will just be like the adult one. But for very little ones, sometimes they can even come and say they have headaches, or my tummy is upset, or they will just say I'm bored, or a child may be sleeping too much or not sleeping at all, or a child comes to school, you see progressively the child's educational status is just deteriorating. That could be a sign. As we say, children are an eye into the family. So they may be feeling sad because maybe mommy and daddy are going through a divorce, or maybe they are being physically abused, they are being sexually abused at home. They may not voice it, but it may tend to show up in so many ways. And for very little children especially, they will come with something we call the ones that will present with somatic symptoms. So maybe this side is hurting me, my head, my stomach. We need to watch out for those. And as you rightly said, it may show in their appearances, and they may not be well groomed and all, but we need to pay particular attention. As they grow older, it will look like adult depression, but a child, as they say, is not a mini adult. And their presentation tends to vary at times. Sometimes even urinating on the bed or soiling themselves when they have already attained those developmental milestones can be a pointer to something being wrong in a child. Thank you.
Thank you very much, Dr. Peggy. That was timely. Adjoa Mensimase, I couldn't agree with you more. She says, just to add to seeking help, I wish to add that seeking help is not a sign of weakness or lack of faith. Adjoa, I couldn't agree with you more. That's very true. Seeking help is very, very important. Another way that we find ourselves. Thank you very much for that comment. Dr. Adamin, what would you say to encourage our participants to see a professional? At what point must we see the professional, the psychologist or the psychiatrist? Dr. Adamin, are you there?
Okay, I'm there now. Okay, thank you very much.
Did you hear my question, please?
Yeah, at what point in time should you see a professional or a psychologist?
A psychologist or a psychiatrist.
And
okay. What do you say? What would you say to our participants to encourage them to seek professional help at any point in time?
Okay, so thanks so much, Dr. Akhtar, for the question. What I'll tell all of us is that, you know what I said earlier, happenings are the same. Whatever you are going through, others might have gone through similar experiences or worse experiences. So I will advise all of us that if you are there and realize that things, the way you are thinking, you're always sad, there's one particular thought that is always on your mind. The moment you wake up, you think about that thing. Before you sleep, you think about that thing. And that thing is causing a lot of stress and you can't help yourself. You have to seek for professional and good professional help or advice. Why am I saying good? Because as I said, if you need help or advice, you can get it from so many sources. Let me be practical here. Most of the time, before somebody would even see the psychologist or come to me for help, they might have gone to other places. And as Ghanaians, we are very, very religious. So when people are going through all kinds of problems, first of all, they will seek for spiritual advice or spiritual help. They may go for prayer camps, they may go for prayers and the rest. I'm not saying they are bad, but most of the time, if you're a professional person and you have limitations, realize that you can't treat this condition. Please refer the person to the appropriate person. Of course, you can be the president and at the same time the vice president. That is why we have job descriptions. So whoever you are, if people come to you for help and you can't help them, please refer them to the appropriate source. Most of the time, before they come to me, they might have gone to see all kinds of people for medications and all kinds of therapies and advice. So the person comes to me and the case is always getting to the worst stage of it. So I'll educate all of us that today's presentation or today's seminar should not be a one-shot event. We should, as individuals, be reading about depression so that we can help ourselves. At what point in time should I seek for help? When you realize that you have been worried for a particular point of time, you are always not been able to sleep, you are always thinking, you have lost weight, things are not going well for you, then at that point in time, there will be the need for you to seek for professional help and advice. Other than that, the issue that you are battling with will still be there, and it may even expand or even increase in its gravity. So most of the time, when people come to me for with depression, if you're a married person, I will embark on a couples therapy. I will invite the husband to the therapy based on the patient's consent. If maybe it's a family, I'll call the family into it. As we are talking about childhood depression, now it is something that is coming up. That even calls for research. A lot of students are not performing well in schools. They come to schools, they can't concentrate. Most of the time, because of what is happening in their environment at home, daddy and mommy are always quarreling. Daddy and mommy are fighting. They are going through all kinds of abuse, physical abuse, sexual abuse, domestic abuse. So the child comes to school and his or her mind is off. So such a child will be depressed. in the school. And of course, in terms of even the depression, my patients, I always tell them that the way you are is the best. Don't compare yourself with others. The moment you start doing comparisons, you are entering into depression, because at any point in time, you get people who may be better than you, and that may make life bitter for you. So in this case, you always have to seek for advice and get the right sources of advice. And of course, in terms of the treatment, I always engage my patients with a lot of relaxation techniques, of which, if time is permitted on this platform, I can showcase a video of a technique that I always give to my patients when they are going through depression, for them to be happy and move on with their lives. So I will advise all of us that let's seek for the right form of advice. Thank you very much.
All right. Thank you very much, Dr. Dame. That was thoughtful there. Alex also made a very good comment with regards to depression in children. He said bullying can also be a factor, and I think I agree. Physical bullying and cyberbullying in schools could also be contributory to depression. So somebody asked, what should we look out for in the children? But I think that their appearance, their mood, and how they isolate themselves and all that could be signs that we need to investigate as parents, as uncles, so that we can help them. Now, Dr. Peggy, are you there?
Yes, I'm here.
Good. We all know what stigma does or has done to mental illness. It is the bane of mental illness. You are working in the premier psychiatric facility. So people even find it difficult to even enter the facility to seek help. You are there, and the picture is different from some, it's different. Me and you, we know that the picture is different. I want you to take this opportunity to destigmatize people's minds that they should be comfortable to enter the place to come and seek for help. What would you tell our participants so that they would also be able to convey the same message to others out there, that if they need help, they should enter this facility and go and seek for help? What would you tell our participants and others?
Okay, thank you very much. So the truth of the matter is that everybody needs help. And mental illness is not a respecter of anybody, so to speak. And you may not be alone with what you may be struggling with. There may be other people who are having it far worse. Those of us who work at Accra Psychiatric Hospital, we are human beings. Even if you are shy to say that I'm entering, you just say that, oh, maybe you're coming to buy spring rolls. We have a canteen, we have very nice food there. So you can come and say you're coming to buy food and come and see us, we will see you. There are people who actually walk into Accra Psychiatric Hospital, not for any, so to speak, major mental illness. Some people come with chronic headaches and we see them. Some people come with small anxieties, we see them. And people who actually come to Accra Psychiatric Hospital, many of our patients get better. That is a form of comfort for you to even tell people that, oh, when you go there, doesn't mean that you are going off or anything. Or people go there, they get medication, they get better. So please come. Even if you don't want you come and say you are visiting, or we order food. People bring food into the compound. So you can be doing a delivery, you understand. But one other important thing is that we shouldn't self-stigmatize, because the stigma starts with you. Once you feel that this is this and that, then other people, it makes it easier for other people to stigmatize you. So let's know that mental illness is common. If we were to count the number of people here, we'll get a lot of people who are even afraid of snakes and all. It's a problem that we can help you. Dr. Odame can take you through therapy for you to get over some of these phobias. So it's not as bad as it seems. Thank you.
All right, thank you very much for that. Ebenezer, I think that just to pick on what Dr. Peggy just said, you wrote that you had an incident where you experienced palpitations at a faster rate, like the rhythm of the heart. And I'm afraid I might die out of that. Can that be depression? Dr. Peggy, what would you say to that? I know that you have to go and seek for professional help, but can that be depression?
So palpitations in itself, on its own, can point to a lot of things. It can point to anemia. It can point to another heart condition. And for us in mental health, it can actually point to an anxiety disorder. So we need to evaluate you and see what other symptoms are there. Do you sometimes have tremors? Do you feel that something bad is going to happen? Are you worrying excessively? We need to take all that into context to be able to say that this is, what do you call it? It may not be a sign of depression, even though it's very common for people who have depression to have anxiety disorder with it as well. So it could be that the depression is with the anxiety disorder, but palpitations alone has to be evaluated to make sure it is not a physical problem before we can say that it is a mental disorder, which more likely may be an anxiety disorder.
All right, thank you. So Ebenezer, I think you need to seek for professional help, and Accra Psychiatric Hospital is one place that you can see, or any of our hospitals. There's a mental health unit there. Please walk in there, have a conversation with them. Don't be impacted by the stigma, because if you are impacted, your outcomes for you could be worse. But if you take that step now, trust me, you are on a better way to recovery and being fine. Now, Dr. Peggy, this hallucination and delusion that you mentioned, depression in older people, could that be linked to this witchcraft accusation in older women and all that?
So it's very possible, and because sometimes the example I gave, the inappropriate guilt and all, people can go around, especially the elderly people, and say that I was responsible for this and that person's death, especially in families, or maybe I killed this person, I did that. If you are not careful, you'll be branded a witch and put in a witch camp, or even sometimes beating because of all this. It may not be your fault. In older people too, it's possible that it could also be due to dementia. So there are possibilities. So in older people, it could be due to dementia with other cognitive, or even dementia with depression together. So it's possible that all these branding as witches could actually be a mental illness.
Great. That's a good one. That's a good one. There was one clarity that I need, Dr. Damin. Peggy has spoken for time. Gifty, I'll come back to you. Make it clear for me, when do I need to go and see the psychologist, and when do I need to see the psychiatrist? Dr. Dama is having issues with this.
Unless I think I made the co-host so that I can always be able to speak. Because as it stands now,
go ahead.
Yeah, thank you very much. So the question is, at what point in time must you see the psychologist?
Make that clarity for me. Make that clarity for me. When should I go and see the psychologist? When should I go and see the psychiatrist?
Okay, so before you can see the psychologist, let me give you certain criteria that would let you know that you have to see the psychologist. So if you are there and you realize that for some time you have lost appetite in food, for some time you have lost interest in all activities. Maybe at first you used to watch your favorite Akan drama or movies, but all of a sudden you don't have interest in all these activities. And you realize that for some time now, you are always sleeping. in fact, you sleep during the night, you have your normal 8-hour sleep or 7-hour sleep, but daytime, you feel so dizzy and you are sleeping. And you also have some kind of pains, maybe joint pains, you have neck pains, or you have waist pains. You are struggling very hard to concentrate. You're always forgetting about things. You can't concentrate, you can't remember things. It should give you an indication that something is worrying you or something is happening to you, and you have to see the psychologist. Because on a normal day, you don't have these signs or these symptoms. But for some time now, you're having all these issues, then please, you have to see the psychologist so that an assessment will be carried out to help you know what the problem actually is. And even sometimes to, as human beings, there's a statement that we are social beings. We live in a society. So even sometimes your friends can tell you that, all of a sudden, you are moody. All of a sudden, you've changed the way you are doing things. That should give an indication that something is worrying you and you have to seek for professional help or advice. Or you are there and you feel that life is not worth living. You feel that you are hopeless. You feel that you are useless. You wish you were dead. You wish you sleep and never wake up the following morning. These are things that should indicate to you that you have to see the psychologist. Yes, for professional help and professional advice, because it is not normal to be having these thoughts. On a normal day, if you have these thoughts, you are always tired, there's fatigue, you can't concentrate, you feel hopeless. You wish you were dead. Even sometimes you even wish going to stand on a mountain and falling down, or you want to go and stand on something and just kill yourself. These are things that should let
Dr.
you...
Dr. Dami, hold your fire. Dr. Dami, hold your fire. You are too much on fire. Let Dr. Peggy speak some. Dr. Peggy, when should I come and see you? When should I come and see the psychiatrist?
So I think that what Dr. Dami is saying is very true. So when you realize that there's a change from what you would term your normal, sometimes you may not be able to recognize it, but somebody else may realize that this is different from you, or this is very unusual. You should seek help. For us at Accra Psychiatric Hospital, usually when you come, the psychiatrist is the first point of call, then we refer to the psychologist. But if you have access to a psychologist first, seek help. If you have access to a psychiatric nurse in your facility, maybe you're in the district or something, seek help. And at whatever level you are, you'll be referred appropriately. The point is to just seek help. And don't wait and say, I don't have a psychologist here, so I won't go. No. Please kindly do, if there are changes which are so different and so impairing. Yes. Thank you.
Thank you very much. The watchword, catchword, seek help when you realize that your functionality has been impaired. Thank you very much, Dr. Peggy and Jonathan. Gifty, are you there? Can you hear me?
Yeah.
Hello, Gifty. Good. So as a psychologist, I present myself for assessment. You have the indication that I have depression. I might be experiencing depression. Going forward, what common management strategies would you employ so that it will lead me to the path of recovery and back to my normal self?
All right, thank you very much. Before I tackle the management skills, I would also like to encourage our participants by saying that depression is a common condition that affects millions of people every year. And anyone can experience depression, even if there's no cause of it or there's no reason for it. But the good news is that depression is treatable. And the sooner you get help, the sooner you feel better. So that's what I want to add up to encourage our participants this afternoon. Then to move to the management, yes, since it is treatable, and the sooner you get up, the sooner you feel better, the first step to manage is a self-help, helping yourself by having a regular exercise getting enough sleep, eating good, healthy diet, and then also spending enough time with people that you take care of. And that will also improve your depression symptoms. Then the next point is that seek for counseling at all levels. Then we can also refer you to the appropriate courts. So your counselors can also help to address your problems and then finally develop some coping skills with you. So that's what I can.
Right. Thank you very much. Dr. Damien, would you add something briefly to that? If she missed something, would you add anything to it? You are too much on fire. That is why I doused your fire a bit. So just a little bit. I have to unmute you again. Oh, I don't know why this technology.
Much, Dr. Atta. Yeah, Madam Gifty and Dr. Peggy have said it's all. So we have to seek for advice and for counseling. We don't need to sit at home when things are not going on well for us. And I like what Madam Gifty said, that millions of people are going through depression, and that is a fact. That is a fact. A lot of people are going through depression because of life issues. So whatever you are going through, please, as participants on this platform, let's seek for help and the issue will be solved. Thank you very much for the opportunity.
Thank you. Dr. Peggy, our participants, very shortly, I'll open the floor so that you could also make your comments and questions. I've read a few of them. HN, I just read one from you. To address the stigmatization from the society, could the MHA embark on more campaigns to address this? Yes, we are working on it. And this program is part on working on the stigmatization. Yes, so yes, your comment is well taken and we are working on it. We are doing our best. So, Dr. Peggy, final question from me. I am not religious, an obedient patient. I have mild depression. I've come to see you. On the average, what is the average time? If everything you tell me, I listen to it, what is the average time that I could recover and be well?
Okay, thank you very much. So on average,
I'm asking this question because I don't want people to, I want people to have that mind that it's easy to get treated, it's easy to recover and come back to life, not to have any idea that it takes so much long. That is why I'm asking this question. So please go ahead.
Okay, thank you very much. So for averagely, a depressive episode will last for 6 months. Averagely, that's how long it will last. So for somebody, as I already said, for mild depression, you do psychotherapy, but for moderate, when you're doing a combination of medication and all, we will continue to treat you for 6 months to a year after your symptoms resolve. So that's what we do. So averagely, when you get better, so all the symptoms have gone, we'll continue medication for 6 months minimum. Then we'll step down the medication over some weeks and stop. That's for a first episode depressive illness. If after that you are okay, then that's it. But if we step down and realize that maybe some of the symptoms are still there, we may tend to continue a bit more. It's different for other people who may have a recurrence in future. So if you have a recurrence, and that one we will maybe like in 5 years, you've had about 2 or 3 episodes. That one we may need to continue the medication for a bit longer, maybe up to like 2 years or something to make sure that everything is okay. But for a first episode depressive illness, we are not going to treat you for life. Once you get better, 6 months to a year, we stop medication. And if you are doing well, that's it. So there is hope for recovery. Yes, even though there's a chance that there may be recurrence, but there is still hope for a recovery. Thank you.
There is hope for recovery. That feels nice in my ears. There is hope for recovery. That feels really nice. So let's tell our networks out there, those experiencing mental health problems, that they should seek help because there is hope for recovery. Thank you very much. Gideon sent this. He says, I hate gossips. It's one of the things that gets me irritated and depressed sometimes. How can I overcome it? Dr. Dami, would you give a quick one to that?
Okay, this is so interesting. Wow. You hate gossips as in people gossiping about you, or others telling things about others to you. So you have to be clear on what he hates about the gossips. So I believe that if you hate about gossips, then you should make sure that you don't engage yourself in certain activities that would put you in a situation where people will be telling you about others. And of course, if somebody is trying to gossip about others to you, you tell the person you are not interested. Because the more you hear the gossip and the rest, as you are saying, it can lead to depression. And as I said earlier, your mind is your health. Whatever you think about can affect you. So if somebody is gossiping about you and you know it is not the fact or they are all lies, you have to try and just let it go and forget about it. Because anybody who gossips to you about others also gossips to others about you. So I believe that you should know the kind of people you interact with, the kind of conversations that you engage yourself in, and the kind of people that you even trust when you tell them issues that may not lead to depression.
All right, thank you very much. Thank you very much. Nana, your hand has been up since we started this program. Is it an intention to ask questions, or somehow you raised your hand? Nana, let me see.
Hello, thank you so much. I think initially I asked about whether we will be able to make suggestions.
Can you please raise your voice a bit? It's hard to hear you.
Okay, thank you so much. Initially I asked about whether we'll be able to ask questions. Thank you for giving the opportunity. First of all, I'll thank you guys for putting this together. I think as a country, we've not really had this enough in the system. We've not really been educated enough about mental health. People have no idea or have no clue what it is about. For about 35 years or 36 years, I actually, to myself, I thought depression or anxiety was just some small sadness that people go through and then you come out of it. Until it really hits you and it puts you in that condition where you're stressing, where you are on edge, constantly on edge, trying to get some thoughts of you're having symptoms, burning sensations, you're having things like headaches, tensions around your head, your neck. That's when you actually begin to distinguish between what you've been feeling all these years and actual depression or actual state of anxiety. It's because we actually have no clue what depression or anxiety is growing up. And maybe if we had, we would know how to manage some of the things that could bring it. So some people would even never get there. These stresses, these things like trauma that could send you there, we've really not taken enough education so people won't go through these triggers that can send them into these depressive moods. In our culture, we have things like Berman's. So we are made to bottle a lot of things in us. When a guy is actually going through some emotional thing, he's allowed to actually put it in himself, not go out there to express it or talk to anyone. And the little I have seen, being where I have been, I think it is these constant stresses or the trauma that we allow ourselves to go through for a long time that eventually pushes us, like the body is unable to realize that it's
okay,
safe
Nana,
anymore.
if you can run up for us, I appreciate that.
Okay, Nana. Okay. The body is unable to realize it's safe anymore, and then it goes into that depressive state. So I'll commend this for you guys putting it together, but I will beg you to do this education more and more, and then spread it to a number of people, because it's very, very difficult getting into. It's not easy staying in these depressive issues. So if the education can go more, I think it will do a lot more good to more people, and then get people to also talk when they are into these issues. Let me add one quick one.
All right, I think that you've made your point, Nana.
Okay.
I think that you've made your point. Thank you very much. You've made your point. You've made your point. Thank you very much. Dr. Peggy, somebody, Linda, said if you can shed a little bit of light, more light on the genetics of depression, the hereditary aspect, if you can throw a little bit of light on it, what is it?
Okay, so as I said, depression can run in families. There have been a few genes that have been found of little effect. So they say it's a polygenetic, small genes that have effects to make it come. We realize that when we say heritability, the percentage at which somebody can inherit depression is about 37%. If it's among maybe twins, the value goes up to almost 50%, around 40 to 50%. Then that's identical twins. Then I think for fraternal, around 20%. So it's been shown, studies have been shown to come out with this figure to say that heritability of depression in families is around 37%. So the genes, but as I said, there has to be an interaction of the genes with the environment. So having a family history of hypertension or diabetes doesn't mean that you will get it. If the circumstances around, maybe there are certain very stressful life events or some abuse or some conflict or something, it may actually trigger the depression in somebody who is already predisposed, who has a family history. So that's, in a nutshell, that's how I can further explain it. Thank you.
Good, thank you very much. So it's a combination of the hereditary factors and the environment. Thank you very much. Thank you very much. I don't see any more hands, but I think that we've done a pretty good job with what we've discussed today. Let me give our panelists a last round for your final comments. Then we bring the session to a close. So let me start with you, Dr. Dami, your final words. Hello, Dr. Dami, your final words. Technology, my goodness. Hello, Dr. Dami.
Hello, Dr. Atta.
Please, your final words.
Okay, thank you very much for the opportunity. So what I will tell all of us is that there's hope, and all is not lost. No matter what you are going through in life, we should know that there's always light at the end of the tunnel, and we should seek for professional help, irrespective of whatever we are going through. We should seek for the right help. And when we seek for the right help, I believe we will get help. Thank you very much.
Thank you very much. Gifty, unfortunately, I have a question here that I missed. Lillian asked that question. She says, what is the difference between stress and depression? Does stress lead to depression? Gifty, just a quick one on that for me, please. Gifty, can you hear me? Well, Dr. Peggy, would you be able to respond to that for me?
Okay, so if I heard rightly, the person wants to know the difference between stress and depression.
And depression. Does stress lead to depression?
Yes, so stress is actually a risk factor, or as we say, it can be a precipitating factor for depression. So stress is, in layman's term, maybe a natural response to perceived threat or something. So it can be a physical one where your heart is beating, you are running away, and a psychological one is the one that we may have symptoms of depression. So you are so stressed, you are either anxious or you are depressed, you try and find a coping mechanism, and if you're not able to cope well with whatever stressor that has come, it could lead to depression or even any other mental illness. So stress is an important factor in the development of depression. Thank you.
Thank you very much. Leland, I hope that your question has been answered clearly for you. It's a factor to depression, and you need to have that coping factors to deal with it so that it does not develop into depression. Thank you very much. Okay. This one, I cannot see who is coming from. People who are dealing with depression, and have some who have come out to share their experiences. Thank you kindly. Okay. So I think that like I did say earlier on, we've done a pretty good job on tackling all the angles from the perspective of the counseling psychologist, from the clinical psychologist, and from the psychiatrist. So we now know, bottom line is that we need to seek help. Dr. Peggy, your final words.
Okay, so my final words are that depression is very common. We can't oversay it, and anybody can have depression. You could have depression, I could have depression. Let's stop judging people. I usually get a bit sad when relatives and people will say that, oh, wait, they were unkwana, you know, sometimes we belittle the factors that contribute to people's unhappiness. So let's all be the support that we can be, because it could be you, it could be me. Thank you.
Thank you very much. Let's provide each other the support. It could be you, it could be me. On that note, we've come to the end of the program. I want to say a very big thank you on behalf of the Chief Executive of the Mental Health Authority, Professor Kwesi, the Deputy Chief, Dr. Caroline Emisa, and the whole staff of the Mental Health Authority. I want to say a very big thank you to our panel members, Dr. Jonathan Odame, Dr. Peggy Asiedu-Ekremet, Ms. Gifty Adjoa-Mensah. Thank you very much for the wonderful job done this afternoon. You've really enlightened us, and want to say a very big thank you. And for you, our participants too, I also want to say a very big thank you. You've always been us, and you've been with us through all the 9 sessions. The 9th, this is the final one. So thank you to you, to our participants. And on my own behalf, I want to say a very big thank you for joining us today. This is the last one for the year. So the Chief Executive, I think when he was talking, you saw him sitting in his car, also doing an equally important job somewhere. He congratulates all of us for coming this far with this work. He appreciates the efforts of all panel members who have passed through the platform from start to date. He appreciates all the participants who have passed through from start to date. He wants to say a very big thank you to all of you. On that note, I want to say a Merry Christmas to all of us, and a Happy New Year. Let's remember that help is out there. We need to take good care of ourselves. We should not hide what we are feeling. There is so much help out there. Let's have fun. Don't do anything that I wouldn't do, but I don't know what you don't want to do. So let's have that fun. Let's have a Merry Christmas. And let's, God willing, we'll meet here next year, same time, same place. Thank you very much. Have a wonderful Merry Christmas and Happy New Year. Bye-bye for now.
Thank you, Auntie Gifty.
Kelly, I see your test. Thank you very much for that. The recorded version will be on our website, hopefully next week. And you can have a look, or you can check our Facebook page. You will find the link there. For your report.